Okay, so now we're going into the heart. This is the guy that's going to keep you all employed. Between heart disease and diabetes, you're going to be able to have a nice house, new cars, and maybe go on vacation every now and then. Because the healthcare system is just going to get busier and busier. I don't really see us getting healthier in America. Anyway, so let's talk about the heart. So this right here is probably one of my favorite topics. So the one thing about the heart is it's about the size of your fist when it's healthy. And it beats almost 100,000 times a day. Okay, that's close to 70 beats per minute. That's not counting walking upstairs, carrying things, anxiety attacks. That's not counting all the other things that actually make the heart really start racing. About 1.5 million gallons of blood per year. That's almost 3 gallons per minute. If you think about this, the heart is this crazy little organ. It never takes a break. It's always going. And it's just a muscle. Size of your fist. We have almost 60,000 miles worth of blood vessels. You would take all your capillaries, your veins, your arteries, everything, and just line them up end to end and stretch them out. It's an amazing piece of machinery. And how well it works is incredible. And when you think about how much strain we put on it, yeah, it's really quite an amazing little organ. Okay. Now, when you break it up, it has 4 chambers. When I get to the end of this, I'm going to teach you the heart really fast. You'll always understand it. Now, when we start talking about the pulmonary circuit, realize the heart receives the blood from the body in the right side. Then it takes that blood, sends it to the heart to get oxygen. From the lungs, it comes back to the heart. On the left side is oxygenated, and then it leaves the left side and goes throughout the body. Systemic is the body, pulmonary is the lungs. Keep it simple. We have 2 atrias on top, 2 ventricles below the atrias. So, we're now going to have, keep it simple, something neutral. Okay, so right atrium, left atrium, right ventricle, left ventricle. This is the anterior, so this is the front. This right here is the posterior, this is the back. Yeah, that's good enough right there. We'll get into all this mess up here soon. If you want to learn something, just kind of study this part. This is a good one. Just take it and blow it up nice and big. Okay? So you blow it up nice and big, and this will tell you pretty much the flow of the heart. So we have our vena cavas. You're not going to see this very good here. Maybe you will. Screen. So our vena cavas. I don't see that very well. Let's go with this color. Silver. So our vena cavas are going to bring, so that's our superior vena cava or inferior vena cava. They're going to bring the blood into the right atrium. Then from the right atrium it goes to the left ventricle. Left ventricle is going to go to the pulmonary. So pulmonary arteries. Okay, arteries take blood away from the heart. Veins bring blood to visit the heart. Now, from the lungs, it's now going to come back to the heart by way of the pulmonary veins. So the veins now bring it back to the heart, and it goes to the left atrium. Left atrium, and it goes to the left ventricle. The left ventricle, now the blood's going to be pushed out our aorta. From our aorta, it's going to go all over the body. Just nice and simple. I'm kind of digging on this glitter stuff. Okay. So, arteries, blood away from the heart. Veins, to visit the heart. Capillaries, where the arteries and the veins come, and arteries are bringing oxygenated blood with nutrients in it. In the capillary bed, it kind of goes and swooshes and circles around the cells, and it drops off oxygen, drops off nutrients, picks up the waste products. But now, as the blood comes from the arteries, the capillary, the arterial capillary, that bed, it goes into the veins because they anastomose, they connect, they touch. Where they touch, now we have oxygenated blood becomes deoxygenated blood in the capillary bed. And now it's picked up CO2, it's picked up waste products, and now that goes into the veins. The veins now take it back to the heart. Okay, pericardium. I want you to understand about that is the pericardium surrounds the heart. Remember, peri is around. Cardium, cardiac, heart. Okay, so our outer is this fibrous, really tough layer. And we're going to have the serous pericardium, which is going to be in between the heart and the fibrous pericardium. So remember, we have the 2 layers. We got our visceral and our parietal. Visceral and the parietal are going to be sitting right within the pleural cavity, but it's the cardiac space in the pleural cavity. Okay, let's look at a picture. Lungs mean pleural cavity. Okay, lungs, pleural cavity. Heart sits in the middle of the pleural cavity in its own space, cardiac space, which is why the left set of lungs only has 2 lobes, right has 3. We need that space for the heart. All right, now we are now going to have the fibrous attachment to our diaphragm. Don't worry about that too much. That's just a stabilizer. Pericardial cavity. That is going to have our pericardial space. We'll keep the fluid, okay? Easiest way to understand that is you put a fist into a balloon, and the inside, what comes around, that is going to be your pericardial cavity. That is filled with the serous fluid. So now we're going to have what? Our visceral layer, which is right on the heart muscles, and then our parietal layer, which the space in between is going to be filled with serous fluid. That is lubrication, because the heart is always going thump, 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 thump. So because it's always moving, it needs to have that liquid. So keep it lubricated. Makes sense. If we have heart surgery and we poke a hole in there to actually go in and do some, do a valve job, put a stent in on an artery or something, if we poke a hole in this, sometimes that serous fluid and everything, we get aggravated and it starts to fill up with fluid. And this space right here gets so big that it starts making it so the heart can't expand. Okay? Once that happens, we wind up having some serious problems. You'll actually see the heartbeat in your jugular vein. You should never have the pulse in your vein. Okay. Epicardium, myocardium, endocardium. We'll start from the inside. So endo means that it's lining the cavities. It is lining the chambers of the heart. Myo means muscle. That is the muscle of the heart. Epi is going to be in the outer portion, external portion, where we're going to have the visceral pericardium. So epi is external, myo is muscle, endo is inside. Endocarditis means we get an inflammation in the chambers of our heart. Not a good thing to have. This is really pretty good. So I want you to be aware, this is the cardiac space right in this area. Okay, that's where the serous fluid is, pericardial cavity. So here we have the intercalated disc. What that means is that's the Z band, the Z line, where our cardiac muscles meet up. Multinucleated, but cardiac muscles do something unique. They bifurcate, they split. So because they split, the splitting allows for some overlap to make it so that there's going to be some extra safety if a heart muscle gets damaged. Heart muscles get damaged, it's called a heart attack. The intercalated disc, that's how you can actually see. That is going to be what? That is our, basically it's our Z line, where sarcomeres come together. Okay, let's see, cardiac skeleton, don't worry about that too much. All I want you to understand is the cardiac skeleton, it's a stabilizer. It gives us elasticity. It makes it so that the heart, because the heart has to be able to expand and contract really rapidly, sometimes it really gets a little bit of, it needs some help, because that muscle, it never gets a break. So we put in this cardiac skeleton to actually make it so it can expand a little bit. It's basically just a way to help out. Toughens up the heart a bit. Okay, when they decided to name the heart, they were obviously looking from the head down, because for some reason, the apex of the heart is the inferior border, and the base of the heart is the top border. So I can't figure it out, okay? So the base is the superior, the apex is the inferior. Right? At least right and left makes sense. Anterior and posterior surface you shouldn't have any problems with. Diaphragmatic surface is just where we're going to have the right and left ventricles, kind of where they come together. Okay, let's not get carried away here. So as you can see, the apex of the heart is right here. So the apex is usually the top, but in the heart it's the bottom. The base you would think would be at the bottom, but on the heart the base is the superior, right up here in this area. Okay, we have 4 chambers, 2 atriums, 2 ventricles. Okay. Let's see. You can see on the external, so the markings. So right here, this is going to be, this is the posterior, this is the anterior. That's about as good as I can do with a trackpad. So we have this coronary sulcus right here. The coronary sulcus does is it divides the ventricles from the atriums. Then we're going to have our ventricular, our intraventricular sulcus. Okay, intraventricular sulcus right there. It divides the left side of the heart from the right side of the heart. Just that simple. This might actually go all the way up into here, but all this stuff just kind of interferes. So you can't see the divider between the right and the left side because we have our pulmonary artery and our aorta and all that stuff in the way. Okay, let me see left and right atrials. So ventricles. Don't want to get carried away here. An auricle just basically means that's the chambers. Okay, the auricles are atriums. A little flap that hangs over. Let's see. Intraatrial and intraventricular septums. Divides the right and left side. Okay, intraventricular, intraatrial means it's in between. It's kind of like a septum is between your nose. You know, it keeps you from digging, makes you only dig one side at a time. So that separates out. Right side of heart, left side of heart. Right side receives from body, left side pushes to body. Look at this up. Atrium's very thin wall of muscle. Get back to some glitter. Okay. So atrium, thin wall of muscle up here. Very thin wall of muscle. The reason why is atriums only have to push the blood from here to here. From here to here. Ventricles. Look at how thick that wall is right here. So that one's nice and thick because that's your left ventricle. It's going to push the blood throughout your body. The right ventricle is not nearly as musculature because it's only going to push the blood through your pulmonary valve to your lungs. Okay, so your lungs, your heart is rather long. It doesn't have to take a huge amount of muscle. But the left side is to push it a good distance. So left side of the heart, more muscle. Okay, so now we're going to start talking about the vena cavas. Boy, they go horrible about explaining all this stuff. So, vena cavas, the superior vena cava right here, inferior right here. Superior receives everything from the head and arms, so that's your venous blood coming back to your heart. Inferior, legs, torso, abdomen, that's your inferior, is pushing it up to your right atrium. Okay, right ventricle, it receives blood from your right atrium. So your blood comes from the superior, and inferior vena cavas. So the vena cavas dump into where? The right atrium. Right atriums push the blood into your right ventricle through your right AV valve or your tricuspid valve. Okay. The right side has one little unique thing in there. It has this moderator band, this little thing of muscles in there. Now these trabecular carnates, this trabecular looking pattern, those are muscles. It allows it to open up and squeeze, open up and squeeze. This right here is your chordae tendineae. This is your heartstrings, and these are your leaflets for your valves. Valve leaflets. Heartstrings, chordae tendineae. Chordae tendineae. Little valve leaflets. Okay, left atrium. Left atrium receives the blood from the pulmonary veins, left and right pulmonary veins, because we have lobes, our lungs, we have a right set of lungs, left set of lungs, so we have pulmonary veins that are going to come from the right and to the left, both of them dump into the left atrium. And the blood now goes through what? The cusp of the left atrioventricular valve or the mitral valve. Okay, left ventricle, thickest. It's going to push the blood through the aortic valve up in here, because that means it goes through the aorta, goes all over the body. So the left ventricle, it just receives blood from the left atrium. Okay. That's good to have a heart cut open. Okay, Heart valves. So we have two AV valves. The right side is the tricuspid, because most of us are right-handed, so when we try to type, we try typing with our right hand. That's just the standard. On the left, it is going to be our bicuspid or our mitral valve. Remember, the left side of the heart is bigger, muscular, so it is more mighty. So the mitral valve is on the mighty side. The two semilunar valves are just going to be our aortic and our pulmonic. Pulmonic is where we're going to get the blood that was pushed from the right going to the lungs. So going to the lungs, the pulmonary valve, going to the pulmonary artery. And then we're going to have the aortic valve, where it's going to be pushed all around from the left ventricle, all around the heart, through the aortic valve, into the aorta. Okay, I just want to jump to a picture. Pictures actually do a lot better. So as you can see, this one right here is the tricuspid valve because it has three cusps. 1, 2, 3. This is going to be the bicuspid. This is the left side, the mitral valve. It only has two cusps. That's simple. Okay. Pulmonary valve, aortic valve. Now, what we have here are these papillary muscles. The papillary muscles are where the chordae tendineae attach, which attach up to the leaflets of the valve. Okay, valve only allows for blood to go in one direction. So after the blood passes through the valve, that valve will close, so when the chamber contracts, it prevents blood from going the wrong way and makes sure that the blood's going to go out the right direction. In other words, this is the left ventricle. Got to clear this up. So, our left ventricle, pretty simple. Left ventricle gets the blood from the left atrium. Now, when the left ventricle contracts, these valves right here are going to close. These leaflets are going to close. They flip up, so the blood can't go anywhere. So, pressure builds, and that makes it so that right here, our aortic valve is going to open, blood goes through there. Now, when this relaxes, the pressure in our arteries is going to come back, and it's going to close these valves in our atrium, in our aorta, which makes the blood won't go backwards. We can have a valvular problem, which means blood's going the wrong way, or a leaky valve, and that causes big heart problems, a lot of surgery, and death. Okay. Let me see, cardiac cycle. I talked about how the valves close. Now you can see, when the ventricles contract, the pulmonary valve opens, and we're going to have blood. So here's the pulmonary valve. This is in blue, which means that it is deoxygenated. This is in red, which means it's oxygenated. Okay? So these are the blood that's leaving the heart. So when the ventricles contract, because they contract together, so the right ventricle is going to push to the lungs. The left ventricle is going to push to the aorta, which is all around. Going to the lungs, we have our pulmonary artery. Going back from the lungs, pulmonary vein. Okay. How do we control this? Circulation means electricity. Rid of this. That's what I really need. Let's see. Artery. Okay, so circulation on this. I'm sorry, circulation. Talking about circulation of the blood. Conduction is electricity. Okay, right coronary artery. Just know that coronary artery means a heart blood vessel. So what we have here are the right coronary is going to be between the right atrium and the right ventricle. Goes through there. I wish I just put a whole picture up. Okay, now the left coronary artery is going to be this big guy right here that comes out. Then it splits down, and we're going to have the anterior branch, which is descending. This is the left anterior descending coronary artery. Okay, what's the interventricular branch? It's running down. The circumflex means it goes around. Okay, posterior ventricular branch. See, ventricular is right here. This is too much, you don't need to know all this stuff. Okay, one thing I want you to be aware of is this. So we have the anterior portion. Take a look. The arteries come directly out of the aorta. Directly out of the aorta. The heart actually immediately, as soon as the left ventricle contracts, it takes 5 to 6% of the blood right to its own muscles. The heart takes care of itself first. Okay? So understand that. This becomes interesting because when we do bypass surgery, we put a hole in the aorta right here and we run it over past the blockage. Okay, great cardiac vein is the posterior. What I want you to be aware of on this one is all the veins drain into the great cardiac vein up here, and these veins now drain right into this little hole. This hole right here is going to be the coronary sinus, which is where venous blood from the heart, which is deoxygenated now, goes into the right atrium to go to the lungs to actually get oxygenated again. Simple enough. Okay. So, systolic, and so systolic just means that they shouldn't do it this way. It's going to confuse everybody. Systolic just means contraction of the chambers. Okay. We usually don't talk about the atrial because the atrial is small. All the atrials do is push blood to the ventricles. We normally go with the ventricles. So, systole is going to be when you feel your pulse. That's when blood is flowing through. That's when your ventricles contract. That's when blood is being pushed out of your heart. So, ventricular systole is going to be the higher number. So, diastolic, 120 over 60 is ideal. The number 120 for your blood pressure is your systolic pressure, which correlates to your ventricles contracting. Diastolic is ventricular relaxing. That's when the atriums contract and push the blood to your ventricles. Okay, that's the cardiac cycle. Don't get confused on this. Okay, diastolic or ventricular relaxing is ventricular filling. That's when the atriums contract. Systolic is when your ventricles contract and they push the blood out of your heart. Okay, when the ventricles contract, the atriums relax. Okay, they're filling. Just understand it like that. Okay, conducting. This is going to be the electrical impulses. So they start at the SA node. Sino-atrial is going to start in the atriums. Okay. Now a pacemaker, when they put in a pacemaker, it's an electrical impulse that actually makes your heart beat at a certain rate. Bradycardia is slow, tachycardia fast. So we start at the SA node. We hesitate at the AV node. Okay. And then from the SA node to the AV node, now what we're going to do is we're going to flow down, it's called the AV bundle. So we go down through the AV bundle. That takes it through the intraventricular septum, which is between the hearts, and then it goes onto the Purkinje fibers on the outside. Okay, so start at SA node. Start at the SA node. Hesitate. The stop signs in Mexico say alto, so AV, alto. You stop, you hesitate. Why does that impulse hesitate? To allow blood to be pushed from the atriums to the ventricles. Then the blood is going to accelerate down the AV bundles. Okay, the AV bundles, the atrioventricular bundles. When it gets to the apex of the heart, then it's going to pass over onto Purkinje fibers, and the heart squeezes from the bottom up. All right. If you have a right bundle block or a left bundle block, it means that we have a problem with the conduction right here. So we don't get a good contraction on whatever side that bundle block is on. So let's just run through this. So you start at the SA node. You stop at the AV bundle. You then accelerate down, you hesitate at the AV node. Then you accelerate down the AV bundle, or the bundle of His, so Vitamin His discovered it, and then you pass over on the Purkinje fibers on the outside. And you go into physiology. We're going into more of this. Going into too much detail on this. Okay. More about these guys. So, let me just sum up the heart for you really quick. Just pay attention, listen to me talk. So, think about the heart in a series of 4. All right? Series of 4. We have 4 major blood vessels. Okay? So, we have the vena cava. So, we have the superior and inferior vena cavas. Okay? Count them as 1. The vena cavas are the main vein that brings the blood to the right atrium. So, when it comes to the vessels, what we're going to do is this. We have the vena cavas. We have the pulmonary artery, which takes the blood from the right side of the heart, right ventricle, to the lungs. Pulmonary artery. Pulmonary vein brings it from the lungs back to the left side, left atrium. Left atrium, blood goes to the left ventricle, and now it's going to go where? out the aorta. Okay, the aorta is the fourth blood vessel. The aorta is an artery because it's taking blood away from the heart. So, the four vessels: vena cava, pulmonary artery, pulmonary vein, and aorta. Four chambers: right atrium, left atrium, right ventricle, left ventricle. Okay, it goes blood into the right atrium to the right ventricle, from the right ventricle to the lungs, through the pulmonary artery, from the lungs back to the left ventricle, left atrium. Left atrium comes from what? Pulmonary vein. Okay, left ventricle down to the, left atrium down to the left ventricle, out through the aorta. So, four chambers, all right? Two atriums, two ventricles. Keep it simple. Now, how many valves? Four valves. We have the right AV valve, atrioventricular valve, or the tricuspid valve. So the blood comes from the right side, right aorta, through the right AV valve, tricuspid valve, into the left ventricle. Left ventricle goes from the pulmonary artery through the pulmonary valve. Okay? So right ventricle. This is a long one. So right ventricle to the pulmonary artery through the pulmonary valve. Blood comes back through the pulmonary vein into the left atrium. Left atrium contracts, pushes blood where? Down through to the left ventricle through the left AV valve or the mitral valve. From the left ventricle, blood is now going to be pushed through the aorta. From the aorta, it's going to go all over the body, but it went through the aortic valve. The aortic valve is between the left ventricle and the aorta. So there we have our four valves, 4 points of conduction. We have the SA node, AV node where it hesitates, the AV bundle where it goes down, Purkinje fibers where it goes off to the side. Okay? It's just that simple. Keep it in a series of 4, and you'll always manage to understand the heart very well.